for me. So COVID for me was really a blessing for me. It allowed me to slow down. It allowed me to address some things that I kind of put on the back burner because I didn't have time to.
Hey guys, welcome back to my channel. It's Dr. Jemecia, the nurse practitioner extraordinaire, and today I have something special for you. If you are experiencing any type of anxiety or depression or any type of crisis right now in this time of COVID-19, this is May. This is Mental Health Awareness, and I have a special guest for you. So stay tuned. Hey guys, welcome back. I am here with Kenyatta Gash. She is a licensed clinical social worker. She specializes in mental health, PTSD, and trauma. And today we're just going to be asking a couple questions of Kenyatta, something to give you guys a little bit of help while you're in this mental health month and COVID-19 crisis. So, hey Kenyatta.
Hey.
Thanks for coming. Thank you for agreeing to have this interview with us.
Thank you.
And offering your expertise to my viewers. So the first thing I wanted to say was, with this being Mental Health Awareness Month, and with all of the COVID-19 going on and people being isolated and dealing with things that we didn't even know was going on within us, depression, anxiety, we're laid off from work. What are some things that we can do to help combat all of this pent-up frustration, anxiety? Anything you want to tell us off the bat?
Well, and that's a really good question. And, to all the viewers, we're all struggling together. So just because we're mental health professionals like myself, does that mean that we are not experiencing similar symptoms that you may be experiencing now? And I think the one thing, Dr. J, is to really give yourself permission to feel that, to not negate what's actually happening to you. If you're feeling depressed, then you probably should say, I'm having some issues with depression, or I'm anxious, I'm feeling overwhelmed. So that's the first thing that we need to just recognize, is this happening? And I'm actually feeling this. The second part about it is, then what can we do about it? I know a lot of people are not really wanting to take medications for different reasons, side effects, beliefs, things of that nature. So what could we do to combat that? We can, first of all, set a schedule. Depression sets us off the mark, and COVID-19 really has changed our whole normalcy as we knew it before. So the first thing that we can do is, get back on track. So if you're working from home and you're working at 8 o'clock in the morning, then you probably should get back up at 6, get your shower and put your work clothes on. We get comfortable in leggings. I know I did, but then my whole mindset changes. But if I'm in my dress or my slacks and my dress shirt, I change personas and get back into work mode. Setting goals. So even if you're not able to work, for the individuals who have been laid off due to COVID, maybe tackle those things that you didn't get to do before, rearranging the garage, working on the kids' room, doing those arts and crafts around the house. Those are ways that kind of get you out of that mindset of depression and or ease your anxiety. We also take walks. I encourage self-care is so very important during this time, your mental and physical, because when you feel better about yourself, your thoughts are more healthier, and it actually increases your endorphins, which is that pleasure. It also helps you with sleep. So some of us are really struggling with sleep, whether we're sleeping too much, which is more of the depressive side, or maybe not sleeping at all, or able to rest because your mind is just racing. So getting those good sleep patterns back into place, eating more healthier rather, because we also know that sometimes when people are feeling depressed or anxious, we turn to food for comfort, and that also can, or alcohol. And so we have to really be careful of why are we doing certain things. So now that we're home, we can be more mindful of what we're putting into our body. We're able to now slow down and make more healthier meals, so that we're able to lose the weight if we want to. We're able to combat depression, as well as really tackle on anxiety. And so Dr. J, another way that we can help viewers answers to combat depression and anxiety is through journaling. A lot of times that a lot of people don't really think of how could that benefit me? Well, one way is that it helps you to release what anxieties you're actually feeling. It actually allows you to get it on paper. It allows you to process some certain things. It allows you to just really come to grips with, okay, this is actually happening. And it also allows you to even go back and to refocus on other things of, oh, I thought I was done with this, or I thought I was over this, and it's still happening, it's still coming up. Also, getting into music. I love to dance, so doing Zumba in the living room, or just putting something on with the kids, and you guys can just do the bebop songs, and because laughter is good for the soul. And so doing things that brings you joy, doing things that allows you to take the stress away or to ease some of your stress. Also, another way is try to have fun. I know that we can't do a lot of things that we used to do, here in Hampton Roads. We love to go to the beach and love to go to the water, but we can still go to Fort Monroe. We can still take walks. We're just going to continue to practice social distancing, things of that nature. Maybe do movie night with the kids or the family members. I have one colleague who actually had movie night in her garage, and some of her neighbors came and brought lawn chairs. The husband put up the projection screen, and so it's almost like doing a drive-in in the garage again. So we have to know how to be creative, because we know this is not going anywhere anytime soon. This is going to be our new norm. What we've known before is past, but what can we do now to rejuvenate ourselves, to get back on track so that we can live our best lives in this moment? One other suggestion I really would like to stress is mindful eating. A lot of times that the hustle bustle of the day, you got the kids and the husband and work and the dog and cheerleading and all these other things that are happening, that we have got away from really healthy eating. And so we're so used to picking up McDonald's, picking up Wendy's, giving the kids Pop-Tarts, that these things are not healthy, especially on an everyday basis. And these causes other issues and stresses that really can exacerbate symptoms of depression and then symptoms of anxiety. So really, now that we're home now, really taking the time to eat more healthier. Again, it doesn't have to be extravagant meals, but just taking the time to really focus on what are the things that we're putting into our body. Also, that's a great time to have family time. Having the kids join in now, if they're older, let one, mix the sauce, let one do the meatballs, things like that, because that also provides pleasure for us. So these are things that, again, I'm hoping that are, useful for your viewers, that, the list is exhausting. We can go on and on about certain things, but these are quick things that hopefully that they can remember to help them to tackle issues, that they're experiencing with depression as well as anxiety.
Okay. So I've learned a lot about myself during this COVID-19 and being confined and isolated. And I feel like I've learned that I'm one of those people who need socialization. Okay. I just know that. And it's been really hard for me, because I feel like I've needed to connect through social media now, through things that I really didn't do prior to. I didn't do YouTube. I didn't do Facebook. I did a little bit of Instagram, but it wasn't for social interaction.
Right.
And I'm just one of those people, and it feels like that has just been taken from me. Right. Just against my will.
Right.
And it has caused me to really find myself feeling a little bit down.
Okay.
What have you learned about yourself during COVID-19?
What I have learned about myself is that I'm an extrovert introvert. So I love being around people, but I love being by myself. I also learned personally that I was doing too much. I am a single mother of a 3-year-old. I'm in school. I work full-time. I have a couple of part-time jobs, and I was just going and going and going and, volunteering and think that all these things are great, but I never left any time for me. So COVID for me was really a blessing for me. It allowed me to slow down. It allowed me to address some things that I kind of put on the back burner because I didn't have time to. Because in the day, you only have a certain amount. You got to get up, you got to get the kids ready, you got to go to work, you got to come come home, you gotta cook dinner, then it's bed, and then it's all over again. So for me, it's been a relief for me. It's been just a stress reliever for me. It allowed me to now work from home, which would have never happened before COVID. It allowed me to spend even more time with my daughter. It allowed me to really relinquish some of the professional responsibilities that I had so that I can focus on me now, so that I can make sure that before I give you this glass of water, that I make sure that I drank first.
So you bring up a good point, being able to work from home as a mental health provider. Medicare, Medicaid has just approved telemedicine, mental health. So just so you guys know, you are able to see your bill and see your mental health provider at home. So that's really, really wonderful. And that just came out now during COVID-19.
Absolutely.
So I want to talk about my biggest struggle.
Okay.
So my biggest struggle during this time of isolation has been time management. I feel like I'm working more since I am at home. I feel like I'm on the computer trying to do more. My schedule is really off.
Okay.
What's been your biggest struggle?
My biggest struggle being at home now is really focusing on what I'm supposed to be focusing on, because now that we have less stressors, it's like, okay, so what do I do with this time now? So now I'm able to focus on and get my report done on time within an hour, versus sometimes at work I'm able to, the phone's ringing, the clients are coming in, their coworkers need this, and there's a meeting, there's a fire drill, there's all these other things going on. So now I feel sometimes I'm having issues of filling up my day. What do I do now? Because I don't always see clients all day. So sometimes I might have 2 meetings in the morning. I see 2 clients. I've done my notes. Now what do we do? So in that time, it's time management. So now what I'm really gonna stress having a schedule. So even I still have my planner from work. I still put in the times that from 8:30 I have a meeting. At 9 o'clock I have a session. At noon I walk. That is my self-care time. So thankfully we live in an area where we have a lot of sunshine. We have great parks that we can walk in. So I do my self-care then. I walk, I meditate, can do yoga. So there's many different things that you can do. It's really just sitting down, just like you will be at work, and planning your day out so that you don't continue to have, this anxiety or depression or feeling of isolation or loneliness that you talked about, so that you can combat that in a healthier manner.
So, just being transparent, earlier this week, you sent out a self-care menu that I would like to share with the audience.
Absolutely.
So I'm going to read it here, and I'll put this in somewhere in the video or in the description. So the self-care menu says this. It says, take a few deep breaths for 5 minutes, stretch your body for 5 minutes, listen to your favorite song. You talked about music, and meditate on your purpose. What is your purpose? Also, you said read a chapter in a book, whether that be for self-help or for pleasure. I like to read for pleasure, although I do read a lot. You also said journal your thoughts, which is on this menu. Take a walk outside, we discussed that. And get crafty, do something new. You talked about that.
Absolutely.
And cook a new recipe. I've been cooking a lot, which is not good, but
And she has not been sharing. Let me just add that. Okay, back to you, Dr. J.
So, for me, even though there's an aspect of feeling like there's some isolation and I don't have a lot of social stuff and I can't be moving and grooving and all that stuff that I do, for me, I think it was also a good thing, because I had been putting off starting a YouTube channel for years. I had been putting off writing down my courses that I wanted to do for nurses, and it forced me to say, okay, so what's your excuse now? Because you have a lot of time. So the mirror was kind of flipped for me.
Okay.
Did anything like that happen for you?
Like I said previously, it was my saving grace, because it allowed me to slow down and really focus on me and my self-care and my mental health. Because unmanaged mental health reverts to dysfunctional mental illness. And it became a slippery slope for me, because I was not dealing with my issues and my traumas. I put them on the back burner. I thought some of them was oh, I'm good now, I'm 38, I'm fine. But it really wasn't. And so COVID exposed that. It literally took the Band-Aid off, and it forced me, to look in the mirror and say, you might need to go back to counseling. You might need to really start journaling again. You might need to really look at how you respond to situations. I became irritated easily, agitated. I was experiencing severe migraines, crying in the middle of the night for no reason, just sobbing. I do also realize as a trauma therapist, we have to be careful that we don't develop what they call vicarious trauma or secondary trauma. And I've been doing this for about 8 years. So that's a lot of weight. And even though I was doing things that I thought was what we're supposed to do, we take our vacations, I would see my massage therapist every 2 weeks, for physical care, making sure that I'm in the bed on time, make sure I'm getting proper rest. But at the end of the day, I was not dealing with what was really eating me inside. So for me, again, this pandemic has allowed me to really examine myself, to do what I've asked my patients to do. Maybe I should do some worksheets. Maybe I should see someone. Maybe I do need medicine. Maybe you need more than just a week. Maybe I am burnt out. So it's a positive for me. It allowed me to really enjoy being with me again, finding me again, finding something new, creating something new during this pandemic.
Those are good tips, and that's all wonderful, and a lot of us will be able to use a lot of that information. But what do we do when none of that is working? Who do we contact?
That's a very good question, because again, having a great support system is definitely necessary to get through this, but sometimes that's not enough. And so if you are struggling with depression or anxiety, the first thing I will probably ask you to do is contact your personal care provider. Talk to them about that. Talk about your symptoms. Talk about what you've been experiencing and how long you've been experiencing that. Even in the midst of that, we have a national suicide crisis line, which is 1-800-873-TALK. We also have a nationally, you can text home to 741-741, and you can speak with a certified crisis counselor. You can Google a therapist. If you're a veteran or active duty military, you can also contact Give an Hour, which is a nonprofit agency who provides pro bono therapeutic services to yourself as well as your family members. So there are definitely resources out there. So never want anybody to feel like they're alone. You're not alone. Even for people who do not have insurances, there are various nonprofits that will be more than willing to help you through this time.
So guys, thank you so much for being here with us today, and thank you, Kenyatta, for sharing with us some mental health strategies during COVID-19.
Thank you.
And thank you guys so much for watching. If you like this video, please like, comment, and subscribe, and we'll see you in the next one. Take care. Bye guys.
Bye.